Good evening, everyone. My name is Thomas Varela. I serve as the Assistant Director of Undergraduate Students here at Temple University School of Pharmacy. Today, we are excited to host this admitted student panel where we have a cross-section of students in our School of Pharmacy and our interest in pharmacy. You will hear from two students that are current Temple undergraduate students that have been accepted into our School of Pharmacy program. And then we also have a student that is currently in our School of Pharmacy program, who will all share their expertise and insight as to their career journey, and their college journey, what they're looking forward to once they enter pharmacy school or what they are experiencing in pharmacy school. And once again, be able to give you insight as you decide, as you begin to make your decision regarding one, preparing for entry into pharmacy school, or two, preparing to make your decision in terms of which college you will attend. So we do hope that this forum will offer some additional insight to help you make that decision. And so with that, we're going to have our panelists introduce themselves. We're going to start with Ruth. If you can briefly just introduce yourself.
Hi everyone, my name is Ruth. I'm currently a third year student at Temple University School of Pharmacy. I did my undergrad also at Temple. I did 3 years as a bio major, and I started pharmacy school in 2023.
Great. Thank you very much. We'll have Alina, sorry about that.
Okay, yeah, you're right. Hi, everyone. My name is Alina. I'm currently a sophomore student at Temple University in the honors program, and I will be starting my PharmD this fall.
Great. And finally, we're going to have Darren.
Hi everyone, my name is Darren. I'm a third year pharmaceutical studies major, and I'm also an incoming first year pharmacy student at Temple School of Pharmacy.
And I did want to remind everyone, we want to thank the Temple Pre-Pharmacy Student Club for partnering with us for this event. One of the things that you will want to do once you arrive in college, or if you are here at Temple, is participate in student clubs like the Pre-Pharmacy Club, because they help to host events like this and other activities to help you understand the career of pharmacy. So I want to thank the student group for your support. And so with that, this first question is for Darren and Alina. If you could briefly describe your undergraduate experience in terms of you've been here at Temple for 1 or 2 years, what has it been in terms of coursework and just the academic side of your journey?
Do you want me to go earlier? Oh, you want, okay. So for me, my undergrad experience might look a little different than some of the incoming, but I took on a 3+4. So I spread out my prerequisites within 3 years. And that included, my general chemistries, my general bios, organic chemistry, anatomies, calculus. And doing a 3 years allowed me also to take on some electives and general education um, classes as well. And I had an amazing experience at Temple University. I really enjoyed the diversity, the research opportunities. We're in a large urban campus, so that's one of the biggest opportunity openers. And yeah, I had like amazing professors, and then also I was also in the honors program, so I had amazing advisors as well.
Great. Alina?
So everyone, like Darren said, everyone comes in with like a different background. So I came in as a bio major on the pre-dental track. So now we have been far from that. And I'm actually taking my prerequisites and entering pharmacy school this fall. I'm also in the honors program, like Darren is. Temple has provided me opportunities like so big, like they're amazing. And again, being at an R1 research school, I'm doing research at Lewis and Katz and clinical research. And again, you can get your hands on anything. So that's why this has been the best opportunity.
Great, great. And we're excited that you made the switch from pre-dental to pre-pharm. We appreciate that. But we just wanted to highlight that one of the great things you hear are both of our students mentioned the honors program. We recently announced our honors college. And so there's been an expansion as it relates to the honors program here at Temple. So that's exciting to know. And we also want to remind everyone, one of the things important in terms of our pharmacy program is our early assurance program. It gives students an opportunity to complete their prerequisites and enter pharmacy school and complete pharmacy school in 6 years compared to 7 or 8 years that is traditionally what you see at other universities. So for many students, that early assurance program will be a great opportunity to save 1 year of schooling and also complete their program. And that is done through our Bachelor's of Science of Pharmaceutical Sciences. So did want to make sure that students know that our 6 year program is our standard program and pathway for those interested in pharmacy school. And so, Ruth, I want to go to you. Maybe I know you've had some Temple experience in terms of being undergrad, but if you could focus a little bit more on your journey thus far at the pharmacy school, how has that experience been in terms of just balancing the coursework and activities and things of that line?
Sure. So I will expand on what's already been mentioned. I want to reiterate, I think especially in the pharmacy school specifically, there's a lot of opportunities and a lot of exposure to different areas of pharmacy. I would say the most common misconception that I hear is that pharmacy is only like retail, like your common CVS, Walgreens, maybe Giant or Acme. But that is 100% not true. Although those are amazing options and pharmacists are heavily needed in those areas, there's a lot more. There's pharmacists in all hospitals, and even within hospitals, there are more specific clinical roles or general staffing roles. There's a bunch of opportunities in the pharmaceutical industry, pharma. There's opportunities in research, and the list goes on and on. So I think Temple does, specifically the pharmacy school, does a very good job at exposing the students to all different types of areas that have career opportunities. And that's embedded in the coursework. You have clinical rotations that are required, so you really get to become exposed to all these different functional areas of the profession.
Ruth, I really appreciate you mentioning just broadening the pharmaceutical industry because yes, there are students that tend to see pharmacy as just your community pharmacy. But when you think about the broader pharmaceutical industry, it is currently a $600 million industry with projections of up to 1.3 billion. So when you talk about economic impact and opportunity to join a profession that is growing, I think that's something that a lot of students don't really appreciate is how much pharmaceuticals in a broader sense is available to students, whether it is through the PharmD program or entering our Bachelor's of Science of Pharmaceutical Sciences and going into industry. So that's important to highlight that. So going back to our undergrad students, tell us a little bit about your extracurricular activities. What are some of the things you do? I know both of you are in a leadership role in with the pre-pharmacy club. Are there other clubs and activities that you participate in? And we'll start with Alina this time around.
Sure, yeah, no problem. So I do a wide variety of things. I'm very involved in the honors program. Actually, I was very involved in creating the honors college. There's something called the Temple Honors Forum, and I represent the College of Science and Technology. And that was a big project that actually we're doing recently, and we're very excited about the Honors College. Dr. Amanda Newber, she's a director, and she's also very excited. I'm also the community service chair for the pre-pharmacy club, which I encourage you, if you guys pick Temple, please join the club. It's a great way to network, meet people from all different areas, all different like majors. So it's amazing. I'm a peer mentor in the honors program, um, and a couple other things. I do clinical research at the medical school along with Temple Hospital. I'm also a research like wet lab undergraduate researcher as well at Lewis and Katz in microbiome. So keep myself pretty busy. I would never want it anywhere else. So now off to you, Darren.
Yeah, so for me, I'm also a little busy like Alina. I like to take on a lot of different opportunities, but for my extracurriculars, I serve as the president of the Pre-Pharmacy Association. This is my third year being on board. So I started my freshman year as a STARS coordinator, and then I moved on to my secret as a secretary in my sophomore year. And then my junior year, I serve as the president. And then I also serve as the uh, public relations of the Pre-Health Asian American Pacific Medical Student Association, and I've been the public relations chair for 2 years now as well. And then outside of like academics and Temple, I also have two jobs. I work as a retail pharmacy tech, and I also work at Mainline Health as a NICU pediatrics pharmacy tech as well. So I do keep myself busy, and I also do research for the College of Public Health.
Great, great. Appreciate that in terms of just the diversity of experiences. Alina, if I could do a quick follow-up. I want to go back. I missed the plot when you mentioned that you were pre-dental and switched into pharmacy. I guess if you could just tell the audience, like, what was something that you saw that kind of made you make the switch? What was something that you kind of said, oh, okay, I actually am thinking about pharmacy now. What was that thing?
Yeah, totally. It's funny because I tell people the story a couple times a day. They're like, "From dental to pharmacy, like, what did you see?" Um, so going in, I liked sciences. My parents were very sciencey, and I was like, okay, like sciencey. What can I think? I like working with my hands. And I like okay, business, and business and medicine. And I thought, ooh, dentistry. So went blind. I actually joined the 3+4 dental. And then a little bit in, I started shadowing, and shadowing is very important. Talking to people about their careers, very important. I really do press that for all of you. And I realized this is not for me. I was like, oh, this is so not for me. Cannot be in someone's mouth for 8 hours. Not, no, no, no. And I said, okay, I'm gonna take a step back and look at different careers and see what I could do. And again, that it was very important. I wanted to see healthcare, and I like also business and law and different types of things. And I stumbled across pharmacy, and I was not very sure about it. And I thought about community pharmacy. I thought pharmacist. I was like, oh, just CVS, and that's all I thought. But like Ruth mentioned, pharmacy is such a vast field, and I have an interest towards industry. Again, it was that merge between healthcare and business, and just being able to provide access on such a large scale on creating medicine that's ultimately life-saving, is what drew me to pharmacy and the pharmacy route. Yeah.
Interesting. Appreciate that. Because once again, many students come in thinking healthcare more broadly, not necessarily sure which way they want to go. And also, too, many students, when they think about their own journey, they think about the healthcare providers that are in front of them, and it's typically the pediatrician, the nurse, and the dentist. And so a lot of times students don't recognize all the other health professions because they might not have had that exposure. Whereas our parents, they know the pharmacist because they know where to pick up the medicine when the kids are sick. So it's one of those things where the parents are aware of the pharmacist and the role of the pharmacist in the healthcare industry, more so than the kids. So Ruth, I want to pivot to you a bit. When you tell us a little bit about what does pharmacy school look like in your third year, as it relates to, I imagine you're not necessarily doing a lot of like the hardcore science content. You're now starting to do your like learning in terms of the internships or the clerkships, and still learning in terms of those electives. Give us a little bit of insight of what that looks like.
Sure. So as I mentioned, the school integrates real life clinicals into the curriculum. So I finish up coursework in 2 weeks, and the fourth year is pure clinical rotations. So it's 8 5-week blocks, and you get sent to all different settings: hospital, retail pharmacy, could be pharma, research. I have one coming up that's at a law firm working on medical error cases. So there's really a lot. Um, yeah, the first year is more like science-based classes, more like medicinal chemistry, immunology, um, kind of getting the science and like the drug structures, looking at a lot of that. And then as you transition into like second and third year, it's taking that and applying it clinically to patients, and working up different cases, um, being put into groups with your peers and working on cases and recommendations, all different types of stuff, as related to the case that you're given. And then a lot of other skills I'd say are also intertwined in the curriculum. Like you have to like present to the class multiple times, so you get to work on like your public speaking skills. in the group. Yeah, I would say that's kind of an overview of the curriculum and how it like changes throughout.
That's helpful. Appreciate that. It is interesting to hear you talk about law and pharmacy, right? When we think about medications and developing medications, a lot of times you will have to interact with law firms and lawyers to ensure that the medications you create are sound legally, not just scientifically. And so, once again, pharmacists have to be cognizant of all the other industries that overlap when you think about healthcare. We're thinking business, we're thinking law, we're thinking HR and things of that nature. So once again, pharmacy is such a broad field that does incorporate additional industries. And so for all of y'all, whoever feels compelled, what was the biggest surprise that you experienced in like transitioning from either high school to college or from undergrad to pharmacy school? And like, how did you adjust to that? We'll start with Darren.
I think like one of the biggest things that people tell you before you go to college, like transitioning from high school is that like, oh, you're on your own, you need to figure out ways to study, like the coursework is a lot harder. But when I got to Temple, I realized how much support there is. Um, I think everyone had those scares, like as a freshman, like, oh, I don't know if this is cut for me, I don't know if I can do the work. But when you realize how much support you have from your classmates, from your professors, advisors, it makes college a lot more enjoyable. And that's what made me get through my 3 years of undergrad. The amount of support that was received, that's what was I was like really surprised about.
Great. Appreciate that. Alina?
I think the biggest thing is sometimes you think you pick a path and you're like, that's it. And so the thing about pharmacy is like you might come in and say like, oh, I want to do community pharmacy and that's it. The best thing about Temple Pharmacy, like Ruth mentioned earlier, is like all those rotations and in undergrad, like the pharmacy school wants you to learn about the different industries, and they have people coming in to talk. I think we had someone come in and do Zoom meetings for us, different alumni. Again, the alumni mentorship, like they want to talk to you and they want to help. So it's very important.
Great, Ruth.
I would say the transition from undergrad to grad school, it's definitely a lot more studying and time required. Um, Sometimes people struggle with that in the first semester, so definitely recognizing that and carving out time every day to study is very important. And kind of what's also already been mentioned, there's a lot of support, like the professors are there for you. They have office hours. They're always responding to emails. If you're struggling or need help, you have questions, they're always there to help you. They want to see you succeed. They don't want you to fail. They're rooting for you. So definitely, utilizing the resources that the school provides is important.
Appreciate that. One of the Ruth, I appreciate you bringing up the point in terms of those study skills, because one of the things to really think about for students is the fact that many of you all, if not all, are strong academically. So you may be the type of student that you may be doing your homework, and in some cases you do it a little bit last minute, or you figure out strategies to kind of still get the A, and then you get to college and you may struggle a little bit with that transition. But I really think college is really helpful, especially for high achieving students, to use the time to work on your study skills and study habits so that when you transition to pharmacy school, you've already established a foundation in terms of how to study, because studying in high school and studying in college is different. And then studying in college and studying in pharmacy school is different. One of the analogies that I use with students to help students understand the amount of work that you do learn is in undergrad, the science content is like water coming out of a faucet. In pharmacy school, it's water coming out of a fire hydrant. It's still water, but the amount that you have to learn in a semester is much more. And so you really want to use your undergrad time to establish strong study skills and study habits, study cadence, so that when you get to pharmacy school and the amount of content you have to learn is increased, you've built a strong foundation. And so as we get near the end of the presentation, I wanted to, one, thank everyone for joining us this evening once again. As you think about preparing for finals, which for many of you is next week, or for many of you who are planning to make your college decision, which is May 1st, we really believe that here at Temple, and then more importantly, the School of Pharmacy, we are well prepared, we are well equipped to help you achieve your goals. As you can see, we have 3 students here that are well on their way to achieving their goals. And so we're really excited that hopefully you will join us, whether it is in the pharmacy school or joining us at Temple University. So I do want to ask each of the students in closing, if you could make a pitch, if you were to say, why Temple? Why did you decide to come here? If you had to talk to a student that's really deciding between Temple and another school, what would you close with to help them kind of think about your journey, think about kind of your experience thus far, and what would be the point that you would want them to know that Temple is the school for you compared to other schools that they may have been accepted to? And so, Ruth, I'll start with you.
Sure. I would say my closing point would be Temple Pharmacy School will expose you to all areas of pharmacy, as I've already mentioned. And the patient population that you'll see at Temple is a patient population that you won't see anywhere else in the city. Being in the heart of North Philadelphia, you get to see people from all walks of life with all different medical conditions that you will not see elsewhere. Like that's pretty much a fact. And everybody pretty much rotates through Temple Hospital on their 4th year. Like I'm there for 3 months straight. So I'm really excited. I know I'm going to see a lot. I'm really looking forward to it. And another part I will emphasize is that we're on our 125th year anniversary of the pharmacy school. So having such a deep background of many years, there's a huge network of alumni, and that's really important too. Like I also work in a couple of pharmacies and so many Temple Pharmacy alums. So the alumni network is really strong.
Ruth, and I appreciate you bringing up the fact that we are located on the health science campus with Temple Hospital. For those that may not know, Temple Hospital is a level 1 trauma hospital, which means we see the most severe patients. And so, once again, in addition to the fact that we are in North Philadelphia, um, is opportunity for you to really learn about the challenging cases that you may have and also the non-challenging cases when you're in a city and when you're in a location that does have some economic challenges, socioeconomic challenges, and they bring that into their healthcare. It really prepares students to really see the worst case scenarios, because then that prepares you for those better situations in the future. And I think that's something to keep in mind when you think about other schools that may not have the training that will be available to you like you will get at Temple, right? It's one of those things where it's like when you've seen the most, the most complex, challenging cases, it's hard to like go back and be like, oh, I've already seen the worst of the worst, so I'm fine now in terms of my professional journey. So that's something to always think about when you think about programming. I mean, you think about schools and the locations of schools, that does matter when you think about the exposure and seeing those complex cases. So I appreciate you sharing that. So Darren, if you could make your pitch, as president of a student club, I'm sure you've had many of students had to ask you that question. What's usually that closing statement?
Mhm. I always mention how Temple has like numerous opportunities and offers it to its students. I knew right off of like high school I wanted to stay with Temple for undergrad and graduate school. And being in a large urban city offers so much opportunities, whether it's the large research network and opportunities, the diversity, the large alumni network, the long history as a pharmacy institution in Philly, and how Temple puts in a lot of effort into the student success. I love the faculty here and how supportive they are. They want to see you succeed. So that's what I always mention to students and why they should always stick with Temple as well. Because I love the pharmacy faculty and I'm like, oh, obviously so excited to start in the fall.
Great, great. We're excited to have you. And so, Alina, closing off with you, what would be that statement that you would give them? Some of those things that you saw that says Temple is the right choice, has been the right choice for you.
Yeah. I'm also an honors ambassador, so this is like the perfect thing ever. So Temple has given me opportunities, like even being able to even make that switch. I feel like at most schools, not possible. Even working a clinical research job as a student worker, being exposed to such a area like that, and also being able to do like niche microbiology research at an R1 school, near the hospital. I volunteer there as well, having the numerous amount of opportunities, only Temple can do that. Um, like Thomas said, we have the health science campus. It's huge. We mingle with medical students, dental students, students across so many programs. And again, the diversity, the professors' willingness to help. Everybody wants to help, even at least if they don't have the answer, point in the right direction. So that was huge when it came to me making the decision for college as well. And now for pharmacy school, like Darren said, we're both very, very excited for this new chapter of our lives.
Great, great. Really appreciate that. And I appreciate you mentioning the R1 status. Temple's one of 18 schools that has R1 status in terms of academics and student success. And so when you think about achievement, we see achievement not just in terms of the research that you do and the opportunity to do that research, but also the success in terms of social, emotional, and also just the opportunity to build lifelong friendships and learning and apply that into your academics. And so with that, we want to close out with thanking our panelists for sharing their insight. Really appreciate you all taking time. As we said, you're getting right into the finals week, so we appreciate you taking a few minutes to share your insight, to share your expertise. We look forward to celebrating you as you end the semester and as you continue towards your academic journey. Once again, we want to thank all the students here, whether you are preparing for finals next week or preparing to make your decision on May 1st. We really hope that you, really take this decision that you have to make seriously. It's definitely an important decision. We really want to congratulate you on all the success that you've achieved. And more importantly, we want to wish you great success on all the things that you hope to achieve in the future. And so we do hope that you will see Temple as your home. We look forward to welcoming you here in Philadelphia. But if not, we really want to wish you great success in all that you do. But once again, we really believe that Temple University School of Pharmacy is prepared to welcome you in and give you the education that you need to achieve all that you desire. And so with that, we want to thank you all once again and have a good evening.